So we're here today in clinic looking at advanced pec treatment. So what makes it advanced? Well, it's basically not just basic effleurage and petrissage of the pectorals being pec major and pec minor. We're going to look at what else can we do to more effectively treat this muscle. So first thing that we're going to do is get you to sit up. So can you sit up for me, Ali? So we've got a bolster. I'm going to pop that underneath the spine, wedge it up against the sacrum, and now lie yourself back down. Try and get as centralized to the spine as you can, and that will start to sink in a moment. What we're trying to achieve with that is to allow gravity just to bring the scapula into retraction a bit. A common postural tendency is for that protraction. Passive protraction, being desk bound, poor posture generally. So we can go some way to correcting that and putting the pecs on a pre-stretch with the bolster under the spine. So a good place to start. So let's get the muscle warmed up. And what you'll notice is that as you start to work through the pecs in this position, it doesn't take much to get the patient to wobble around. So sometimes what you may need to do is just to place a hand on the other side, and then we can work through with an open palm. And with men, it's, nipples generally, they're okay to be exposed, but we don't want to treat them. There is pec major tissue behind it, but we have also got a very small amount of breast tissue in there as men, and it can be irritated. So let's leave that alone and work around it. And as we're working through, we're looking to see actually what's happening. Is there a localized twitch response to indicate trigger points? How does it feel? Does it move uniformly under the hand? Trying to keep that pressure constant and consistent. So you'll notice there's a variation. We've got some effleurage going on, which is longitudinal strokes going with the fiber direction. And then we've got some petrissage, which is transverse, strumming across the fibers. But that would be basic pec massage, wouldn't it? So let's see, what can we do that we would call advanced? First thing that we're going to do is a pec minor MET. So pec minor is that one in there, and it's going to keep the shoulders forward into protraction if it is tight and restricted. So let's begin by getting the patient in a better position with the bolster in place. MET then, I want you to push your shoulders up into my hands and hold that there. So we're going to hold that for 8 seconds. 3, 2, 1. Deep breath in for me. Breathe out, relax. Good. And let's push those shoulders down. Make sure you're using the broad thenar eminence of your palm, of your thumb, because otherwise that can be quite painful into the coracoid process. I'm going to hold that there for 10 seconds and then repeat. So there's a few ways that we can improve on this. The first way, I'm going to use the patient's arms to my advantage. So if you can turn your palms face up for me, please, and then bring them just slightly off the edge of the couch. Perfect. So let's use the weight of those arms to our benefit. Okay, one more time. So push up into my hands. Good. And you'll find that there's not too much distance we can go. The range of motions can be fairly limited, but let's use an RI technique now to increase the effectiveness of the MET. Deep breath in. Breathe out, relax. Relax, relax. Now squeeze your shoulder blades together. They're going to take themselves to the next point of bind and relax. And we can then hold them there. So we're going to hold that there now for 10 seconds. If it's the final MET and you're doing traditional MET, you might want to hold that there for 30 seconds. But actually, this being an advanced video, I'm going to bring in some soft tissue techniques on top of the MET. Okay, so one more time. Push into me. Let's use that PIR again to its best effect. Hold them for 8 seconds. 6, 7, 8. Deep breath in. Breathe out, relax. Relax, relax, relax. And this time, I'm going to use some massage strokes through the pecs. We've got that post-isometric relaxation effect. In theory, the pecs should be more responsive to what it is that we're doing. We can use that small window of time to work through the pecs with my weight pushing down and still applying a stretch to pec minor. Great. So now let's get the arm moving. Let's get the joints moving. I'm always a fan of joint movement to stretch the muscle and to get deeper and more effectively into it. And I think what we're looking at now, we're going to do an STR. And instead of my thumb moving over the tissue, we're actually going to apply a lock, which is a static lock, and then get the tissue to move under my thumb. So it's kind of still massage, really. We can do that passively. So I'm going to use knuckles to start with. I'm going to bring the arm out to the side, and we're going to use external rotation. So pec major internally rotates. So to stretch it, we externally rotate. So let's apply the lock, knuckles in, and then slowly externally rotate. So what I'm doing here is not just applying the lock down, but I'm actually applying some tension down and away from the insertion. And with each repetition, I'm slowly bringing that lock in more medial, and then we can go with a more fluid and my preferred technique of massage and movement, which is an STR, but instead of that static lock, we've now got the knuckles and the fingers trailing into that space, the intercostal space between the ribs and between the pec fibers. And if we're struggling and you think you need more force into those tissues, we can always go with an active STR. So hold your arm there for me, please. Good. And then when I say I want you to externally rotate, just like I did, okay, away you go. So I'm applying the lock now with the thumb, solid lock. What we also get here, and come back, is the RI effect. Okay, one more time, of the external rotators. So as they're working, come back, go again. The internal rotators are being sent a message, a signal by the nervous system to say relax, and back, which makes them more responsive to the technique. So let's have a look at abduction as well. We're just thinking in terms of opposite movements of pec major specifically here. So pec major, two major actions is to adduct the arm and internally rotate. So we've used external rotation, which is going to stretch the fibers. We can also use abduction, which is going to stretch the fibers. So if we go passively, like we did just now, we can go in again with knuckles. We don't have to use knuckles. We can use broad palm, could use thumb, although it's exposed with a passive technique. But I'll be far more effective here if I can get the patient to do some of the work. So when I say I want you to do exactly what I just did, okay? Bit slower than my movement. So let's go in as close as we can to the insertion. Let's go down, away from the insertion. Okay, away you go. So I'm only reinforcing with the fingers here. I would use my whole palm if I wasn't trying to show you what I was doing. And back. And go again, and you'll notice that I'm stood at the head end, superior to the patient, because otherwise you'll get in the way and restrict their movement. And the tissues are now moving underneath my thumb. I'm not trying to, but I'm just allowing that to happen. And back. So you can see how this is actually quite similar to a massage stroke. And one more. I'm trying to cover as much of that square inchage of fibers as we possibly can. And back. Good. So we're going to finish off with some general effleurage through the pecs, just to get that localized microcirculation back. And also, if there's any guarding, any sort of protection, any protective kind of instinct that happened there through the nervous system from that deep pressure and quite intense treatment, then we can switch some of that off with some gentle massage to finish. So that's an advanced treatment of the pectoralis group.